I'm Indu Subaya. I'm the co-founder and president of Catalyst at Health 2.0, and I'm so thrilled today to introduce one of two winners of the Robert Wood Johnson Foundation Emergency Response for the General Public Innovation Challenge, which asked innovators to develop a health technology tool to support the needs of individuals as well as healthcare systems affected by a large-scale health crisis, such as a pandemic or natural disaster. So I'm here today with Rick Peters, who's the co-founder of this winning team, binformed covidata. binformed is a clinically driven, comprehensive desktop and mobile infectious disease epidemic and pandemic management tool targeting suppression and containment of diseases such as COVID-19. Rick Peters will be presenting today and sharing a little bit with us about his experience through participating in this challenge and looking ahead. So Rick, welcome. And tell us a little bit about your submission to this challenge and what you built.
Andrew, thanks for having us in for the competition. We really enjoyed it. Phenomenal teams we were up against, and we greatly appreciate the opportunity. binformed basically came out of our clinical frustration with what's happening, and this is shared across clinicians with the COVID pandemic, and that many of the tools that we had available were not adequate to do the things we needed to do, really to identify the disease, and as you stated in our introduction, to sort of suppress and contain it. We still think we're at the position to do that, even with this recent surge. And so our original intent with the product was to build it for large-scale institutions. And we realized that every institution was doing their own thing. We basically built it into a personalized product that anybody could manage their own health and safety, particularly with COVID-19, but also for other communicable diseases. We don't think this will be the last pandemic.
Unfortunately, but hopefully we'll be prepared more in the future thanks to products like yours. What was the inspiration to build this platform? Tell us about how you went about coming up with the idea.
We really came from two directions. One was a notion of what's the most effective way to manage your individual health and safety, and that has to do with the common things such as a symptom checker, the notion of where you go and what kind of protocols you use, whether you're wearing a mask or social distance, that sort of thing. And then coming from the other side was the notion of what is the population risk to you and to the population. So wherever you live, what is the risk of you going outside or going to a venue or other things like that too. So we broke that down into two pieces as well. One was a specific venue. So we built a dosimeter, which would allow you to define for a venue what your risk was there. And then we built covidata, which was this analytics tool set to look at areas, first by county, and then we've now got it down to zip code. So you can look at zip codes and do comparisons about what is the actual hospitalization level, the number of positive tests, the test rate, the death rate, things like that as well. So you could look if you wanted to travel or things like that, what your specific risk should be.
That's really interesting. I live in Los Angeles, and certainly neighborhood by neighborhood, there's great variability in rates.
Indeed, one of the interesting things we find is if you take, and this isn't, this is well known in the press, but doesn't seem to be as well followed by public health, is that if you take a model of mean income and a map of that, and you lay it over the map of the zip codes that have increasing infection rates, deaths, and all bad outcomes, they match up perfectly. And this is a socioeconomic disease. It's really affecting our essential workforce as much as anything. And that overlaps into long-term care, it overlaps into care of the elderly, and overlaps into our healthcare facilities too. And even in this surge, we're seeing that predominate rather than spread into the general population. It's heartbreaking to see that. That's also why we try to develop it so it has English and Spanish, and the ability to, because we're seeing this in African-American communities in the Northeast, we're seeing it in Hispanic communities in Texas, California, and other places like that as well.
That resonates with my experience as well. So I agree with that, and a lot of work to do to address those much deeper systemic issues. You're a veteran tech entrepreneur. How did you and your team benefit in any way, if you will, from participating in this challenge? Was there sort of any unique opportunities that going through this kind of an experience provided you guys as creators?
Oh, absolutely. I think these kind of competitions are fantastic because there are two key things they do. One is they sort of get people to coalesce around a target or something to actually work towards, a general subject or things like that, which you provided here. And also, I think it's a motivator in terms of timelines, deadlines. These are always good for development teams. And I think it allows you to be a little more creative because you're not just building a commercial product, you're actually going towards a goal. and you're trying to, it gets out your competitive juices, so to speak, in both a positive and in a beneficial way, as well as just getting you going. The other thing too is I think it was wonderful to look at the other companies that we were in final competition with. And I think, as we mentioned during the presentation itself, we really, really, really admire the other companies that we were competing with in the final round. And I'm really excited that two of us won first place in our division, because I wish all three of us could have, because I think everybody's doing good work. And it's overlapping, it's complementary, and that exposure is fantastic.
Right. It's not just competition. It may lead to collaboration in the future as well.
Yeah, I think this is something that Catalyst and RWJF have always been about, which is cooperation. It's sort of pushing the envelope and not having this as a purely competitive issue relative to commercial reasons, but actually we're trying to solve problems which are inherent in healthcare. We're trying to solve problems relative to IT and such like that too. And it's just a great environment. And we really appreciate the opportunity.
Fantastic. Well, let's take a look ahead a little bit. You kind of headed toward this deadline to meet certain requirements, but where are you taking the platform in the future, and what kind of expectations do you have about its impact on the larger public health space?
So it's a varied answer. One is that everybody is doing similar things to what we're doing, and that makes it relatively complicated to carve just as it's like a straight line to basically product deployment and implementation. And that is that a lot of people are looking at symptom checking, they're looking at population health management, they're looking at things like that. We don't see a tool out there that's really targeted towards individuals and to families and such. And we're hopeful that we wouldn't even need this product, because the vaccines would come out and we would have not this second surge and such like that. But we're seeing more and more a need for that. So our strategy is to tie it into some of the other work that we've been doing in general public health, population management, and individual health, and package it as something that would be of real benefit to individuals and families, and then try to partner with organizations. One, there's certainly a benefit to people who are doing fine relative to the ability to socially isolate and such like that. But what we'd love to do is find a partner who would be willing to take this into those disadvantaged communities that we both talked about, which is that we think would have the biggest individual impact. And they're the people who need, I think, what we provide, which is privacy, protection of their individual information, and making sure that they can manage their own situation without being in fear that their data is going to be shared, other things like that as well. So we're trying to balance utility, public health, as well as understanding people's reluctance to share data, if that makes sense.
Absolutely, and all incredible determinants of the success of future containment efforts. So congratulations to you. And before you go, any plans for how you will use the grand prize of $17,500?
Well, I think we'll pour it back into the product. We'll buy a bunch more Amazon credits, and we're all working on this without salaries. So I think the key thing is to put it back in the product and really keep doing interesting things with it. And we cannot thank RWJF and Health Catalyst, Catalyst 2.0 enough for that.
We're thrilled about your having won, Rick, and wish you all the best.